watching India's first doctor-oriented show, Doctor Opinion, and opinion really matters. Now today we will discuss about the sudden cardiac arrest, and for this we have a very renowned personality from the health fraternity, Dr. Mohsin Wali. Dr. Mohsin Wali is also known as a physician of President of India, and he got lots of awarded. In 2007 he got awarded as a Padma Shri award by the Honorable President APJ Abdul Kalam. And welcome to our show, sir.
Thank you.
Sir, what is sudden cardiac arrest?
You know, sudden cardiac arrest is a very ambiguous term. People think it's a heart attack, which is a misnomer. Sudden cardiac death is a death which does not give you more than 1 hour to treat, and it takes place within 10 minutes of the occurrence, and you can't do anything unless you have CPR, unless you have defibrillator. It is not due to myocardial infarction as it is commonly believed. It is due to either acute arrhythmia, a fatal arrhythmia, or a defect in the heart which suddenly allows the blood not to go to the system, or sometimes it could be like a head injury to the heart, and cardiac arrest takes place. So this is totally different from what is so-called heart attack. And heart attack gives us time. It gives us 6 hours to take the patient, to wheel into cath lab, to do his stenting, or to decide if he needs a bypass later. So all this is to be deciphered, and these days what we are getting is sudden cardiac deaths which are increasing day by day, and lot of theories are popping in, but one theory is correct. Stress and post-COVID effects on the circulation is, I can say definitely, is causing this increase in the sudden cardiac arrest. Other theories, like whether it is due to vaccination or side effects of vaccinations or something, I do not subscribe to that. So far studies are going on. So what we need to deal with sudden cardiac arrest is to screen the people, young people. You must have heard in UP, one of the small towns, villagers, youngsters suddenly died on honeymoon night. This is strange because they were non-smokers, husband and wife died together, and they had a stressful night or whatever, but that took place simultaneously. This type of cases are not reported in the literature so far. So this was a peculiar honeymoon death case. Both of them died. So many people have died during dance, during walking, while doing gym, treadmill, and running. Many CEOs have collapsed.
Right.
And very famous football player, he died. Suddenly he died in the field, and there are videos available on YouTube how Gamlin died. And this is cardiac concussion. So it is also named in the literature commotio corde. These kind of deaths are classified under sudden cardiac deaths. Fatal ventricular arrhythmias, ventricular tachycardia, deteriorating into ventricular fibrillation, causing asystole, leads to sudden cardiac death. There are congenital syndromes, very commonly known. One of them is Barguada's syndrome, in which there is a conduction defect. Hypertrophic cardiomyopathy is one of the most important cause in which sudden cardiac death can take place. So I would put with that athlete's heart also. You see, rarely we used to talk about sudden death in this context in the past. Like when I was doing my training, General Joshi, who was chief for army staff, he collapsed in the golf field, and he was one for whom everybody could vouch a perfect health. He was checked thoroughly by Army Medical Corps. So these deaths were taken into account. But now every third or fourth day we are documenting a death either on the stage or playing some play or running, walking, as you said very rightly, in the gym, treadmill. And so many people we have lost. People who have recovered after COVID and those who have long COVID, we have lost them also. It is a known fact that in India, cardiac disease, what we know as young or cardiac disease, coronary artery disease of young adults occurs 10 years younger to the world population. But What we are talking today is happening over and above that, beyond that, and we are noticing sudden deaths due to either coagulative defects or arrhythmias, and they should be very much looked into seriously. I was giving a thought to someone even just now coming to this talk that we should install cardiac defibrillators at all the places of public importance, like receptions of hospitals, ticket counters at the railways, airports, hotels. So there, if there is a trained person, he can save a life. Abroad, in European countries, especially in Switzerland, there were many trials. They send a defibrillator by drone, and they have a central unit which monitors the whole city, and they receive the 911 calls, emergency calls, and they locate. After that, everything is done by computer, and drone delivers the life pack, and the person gets rest of the instructions through the central console on phone, and lot of lives have been saved. I'm proud to say that in Gangaram Hospital where I work, we have installed cardiac defibrillator on each floor at each reception of the crowded OPDs, and we have been using them. So these are the backgrounds for which I was talking. References are that in males and females this is going to be almost equal, although the incidence is more in males. Smokers have increased susceptibility to sudden cardiac deaths. Those who have worked from home and have developed diabetes to the tune of 7%, they also have sudden cardiac deaths, and the incidence has been increasing. India, country like India and China, they have a lot of obese population, and since India is going to be a young country, we have to be very, very careful about sudden cardiac death, and one should be aware of CPR. We are going to have a seminar in Vigyan Bhavan, and we are going to train people in batches for CPR, and on Doctor's Day we are going to take pledge that every one of us would learn CPR. So losing lives suddenly which can be saved at a young age is a big challenge for the medical fraternity, and what we have lost, like Damar Hamlin and our famous actor Raj Kaushal and so on, and many youngsters, many CEOs, we have to take lessons from them, and we have to prevent sudden cardiac death. As regards routine screening, a lot of people ask, what should we do? And what should doctors tell them? Yes, doctors should tell them, check your blood pressure regularly, check your blood sugar regularly, and then get an ECG at least once in 6 months. My boss one day suddenly called me when a young cardiologist from Gujarat died recently. He said, get your Holter. So Holter monitoring is a very important test for which I strongly recommend that once in a year, if you have angina-like symptoms, get a Holter monitor regularly. And of course, the gold standard test is angiography. Coronary angiography after a positive treadmill test, or echocardiography as a routine procedure every year at least should be the routine method if the patient is coming to a cardiologist. I do echocardiography more frequently and try to catch people who have myocardial motion abnormalities, and then I get them fully investigated, and 10% of them are positive for coronary artery blocks, and we can treat them on time. Secondly, I would also like to emphasize here that people who have got stents implanted, sometimes they stop the medication, and this is a very serious strategy. Stents get obstructed, blocked, and then it can also sometimes lead to problem. So summing up, we can say that sudden cardiac death is a preventable cause of sudden deaths, and if one knows his cardiac rhythm irregularity or coronary circulation irregularity or a predestined heart condition or a congenital defect, so these all cases can be treated and many lives can be saved. Lastly, I would say adapt a healthy lifestyle, quit smoking, quit alcohol, have a good night's sleep, and get yourself regularly examined by a cardiology. I would also wish that people should adapt healthy practices in the day-to-day life, including good, highly nutritious diet, balanced diet, and avoid junk food. Junk food is becoming a greatest menace in the young population, and we should prevent it on time. Already we are going to have a capital of diabetes, and next is obesity, and then the things will go haywire. So also add yoga to your lifestyle. So have a normal and healthy food, healthy lifestyle, adequate sleep, quit smoking, stop alcohol, and de-stress yourself by the means you like. Thank you.
Thank you. Thank you so much, sir.